I read this article in the New York Times last week and I thought it was interesting to share. Pap tests are a screening test for cervical cancer, and we start them as early as age 21. But when do we stop? The guidelines state that we actually should stop at 65. And when I mention this to patients, 50% are super relieved, thank God I don't have to do this test anymore. And 50% are extremely anxious. Oh my gosh, I've been getting this test all my life. I don't want to die of cervical cancer. Don't stop. So what do we do? And the guidelines state that we actually stop at age 65 if you've had 3 negative pap tests in a row. And that's because cervical cancer is extremely slow growing. Unlike other cancers that can be pretty aggressive like breast, colon, or brain cancer, cervical cancer has plenty of precancerous stages and gives us a lot of warning before it actually becomes cancerous. And so this is the reason why if you've had 3 negative paps in a row, which span a period of 10 years, because now we actually do paps every 3 years, so that's about 10 years. So if you've been negative for 10 years, you're good to stop. There are some reasons why you would want to continue PAPs after 65 though. So the first reason is if you have not had 3 negative PAPs in a row, then keep doing them. Number 2, if your mom was exposed to DES when you were a baby in her uterus, then you have to keep doing it yearly. And this is because DES is a chemical that has been linked to cervical cancer. Number 3, if you have been engaging in high-risk sexual behaviors, keep doing them. And number 4, if you've had a history of endometrial cancer.